The day Kelsey was found unconscious, the Arizona Rehab campus in Tucson was expecting her. She had a bed reserved there to begin treatment again. Dr. Leonard Ditmanson cared for her during previous trips to rehab beginning in 2017. He says Kelsey went through detox at least 4 times. He spoke at her funeral.
An evil has come to this land. An evil like no other. A false light seeking the souls of our children and our sisters.
In our studio, Dr. Ditmanson explained why the number of people using both heroin and meth is on the rise.
Well, I think the reason that there's so much mixing of the two is that, again, the heroin is very potent as well. And it's almost too potent in so much as it causes a lot of sedation, drowsiness, or what we call nodding off. Well, if the effect is so potent that you fall asleep, that defeats some of the purpose of taking the drug. So the methamphetamine is used to prevent the person from falling asleep or from nodding off. And that's more, I think, a lot of the use potential is as an antidote, if you will, to the sedative effects of the heroin.
According to the Drug Enforcement Administration, meth doesn't have any natural substances. The National Institute on Drug Abuse says chemicals can include over-the-counter cold medicines and even ammonia.
The problem is that it's being mixed with so many other drugs, including, most recently, we've been seeing a large surge of what's called MDMA, or ecstasy, that's mixed with almost all the methamphetamine that we're seeing in Tucson.
How easy is it to stop using methamphetamine?
Not easy, not easy. And the problem is that we don't have any what we call medication-assisted treatment. There are no antidotes or medications that substitute for the effects of the methamphetamine. So the only way that we can really make an impact is through abstinence-based intervention. But there's a lot of craving and a lot of withdrawal and it's a neurostimulant. So when they stop using, the brain becomes very depressed and yearns for the stimulation effect of the methamphetamine.
Last year, the Centers for Disease Control say 70,000 people died of drug overdoses. Among half of those deaths, the user had more than one narcotic in their system. Statistics from another report show meth-related deaths jumped from less than 2,000 to more than 6,000 in 5 years.
You treated Kelsey. How is it that someone like Kelsey found her way from heroin onto meth?
Unfortunately, I think one of the feeding processes that leads to the use of methamphetamine is the widespread use of neurostimulants in the treatment of attention deficit disorder. And there are a lot of children and young adults that need treatment with neurostimulants, but how much treatment is needed is really a controversial area of medicine now. And those are all amphetamine salts, those derivatives of methamphetamine that are used for other treatment of attention deficit. In her case, her early exposure was to pharmaceutical use for the treatment of attention deficit. There is more evidence that early exposure of a developing brain to a neuropsychostimulant does potentially create an environment in the brain where years down the road the brain will need or want, or pick a term, crave, that stimulatory effect.
Her mom and dad said she also had anxiety and depression. So at one point she was on Percocet, oxycodone, anxiety, depression medication. It sounds like the perfect storm to create some sort of addiction, and her parents say that she had tested positive for an addiction gene. Is that possible?
There's more and more interest in what might make a certain individual more susceptible after taking maybe a 2-week course of oxycodone for a knee replacement or surgery. There certainly seems to be some, not so much genetics as what we call epigenetics, that certain individuals exposed to certain substances are going to develop an addiction issue over other individuals. I think the science is still out there, but we absolutely need to know more about this. Because if we can avoid treating younger people and exposing them to these drugs, or at least using them more cautiously, we're definitely going to be making an impact on who develops full-on addiction.
How did this happen to someone like Kelsey, who comes from a middle-class family, seemingly with loving parents, a strong family situation? How does this happen to someone that, you know, we see smiling and jovial in many of her pictures and videos?
Well, as you know, she was an A student at Northern Arizona University, and we know for a lot of individuals, both the amphetamines and the opiates are almost performance-enhancing drugs in a certain perspective. They make you feel better, that you stay awake longer, you can get your homework done, you are more attentive, all sorts of positive effects that are perceived from the early effects of the drug. But as time goes on, the body becomes more tolerant, and this is true of the amphetamines as well as the opiates. So you need more to achieve the same effect. You're taking it all day long as opposed to maybe just before you have a test the next day. So the abuse potential just escalates and snowballs in a very bad way.
How affordable is it if you want to treat an addiction to these powerful drugs?
No, it's a horrible problem, and I think the point is that this is chronic disease management. The concept for a lot of addiction that you just have an intervention of some kind, maybe a 5-day detox, a 30-day residential treatment, even a 90-day residential treatment. I think that modeling is not appropriate anymore, because those brains are remodeled in such a way that it is a chronic disease. And the chronic disease, like diabetes or hypertension, is a lifetime of management.